My name is Dr. Michael Churchill-Smith, and I'm a general internist and senior physician at the McGill University Health Center. Collaborating with me in this video is Dr. Michael Libman, Chief of the Infectious Diseases Division. The appearance of the H1N1 virus in the spring of 2009 has caused all of us to be concerned for our health, our family's health, and we all have many questions as to how we should proceed in the coming months. Fortunately, our medical understanding of this disease is advancing equally as quickly, and we do have medical options to ease our symptoms, minimize the risk, and at the same time seek treatment when necessary. Please do remember that the great majority of us who contract H1N1 will be fine. What you will find in this video is a short background of the disease, information to help you to recognize the symptoms of H1N1, and the actions that you can take to reduce the risk of catching or spreading H1N1 at work, at home, or at school.
I'd like to start by talking a little bit about influenza, or what people call flu. The symptoms of influenza, whether they're the regular seasonal influenza or this new, more recent H1N1 influenza, are actually much the same. And the importance is really to try and distinguish influenza from an ordinary type of cold or other viral illness. The first and the most important thing in making the distinction is really the appearance of fever. We say that you have a fever when you have a temperature of 100 degrees Fahrenheit or more, 37.8 degrees in Celsius. Less than that, and it's much more likely that you have just an ordinary viral illness. The other thing about influenza, you often feel really sick. You feel like a car hit you, and most people describe that they feel much sicker than they do compared to just an ordinary cold. Cough is usually a prominent part of influenza. It appears a day or at most 2 days after the fever starts. The other things that are typically associated with all types of influenza are a lot of muscle pains, joint pains, often chills, sore throat, and typically some runny nose and headache as well. All these signs of influenza usually last somewhere between 2 and 4 days and then gradually get better. With the H1N1 virus in particular, we seem to be seeing people complaining a little bit more about digestive symptoms as well. So they come talking about nausea and maybe some vomiting and diarrhea.